welcome to our telehealth medicine information video. I'm Garvin, and this video is on Verapamil. So what is Verapamil used for? It's used for high blood pressure or hypertension. Also as a regular long-term treatment to prevent angina attacks. How does Verapamil work? Verapamil works by slowing down the movement of calcium through muscle cells that are found in the heart and the walls of blood vessels. It does this by blocking calcium channels on these muscle cells. Calcium is needed by the muscle cells in order for them to contract. By depriving them of calcium, Verapamil causes the muscle cells to relax. This action of Verapamil has two main effects. It slows down the rate at which the heart beats, and it allows the blood vessels in the body to widen. When the heart beats more slowly, the pressure at which the blood is pumped out of the heart is reduced. When the blood vessels in the body relax and widen, this decreases the resistance that the heart has to push against in order to pump the blood around the body. But these actions reduce the pressure within the blood vessels. This means Verapamil can be used to lower high blood pressure. Slowing the heart rate also reduces the energy used by the heart to pump blood around the body. This in turn reduces the heart's need for oxygen. At the same time, widening the blood vessels improves the blood and therefore oxygen supply to the heart. Both these features mean that Verapamil can be used in the management of angina. The chest pain of angina is caused by insufficient oxygen supply to the heart. As Verapamil improves this oxygen supply and also reduces the effort the heart has to make to pump blood, it can be used to prevent angina attacks. Verapamil tablets are a long-acting or modified release form, or that's Verap tablets are modified release form of Verapamil. This means they are designed to release the Verapamil slowly and continuously over several hours to produce a steady blood level of the medicine throughout the day. So how do you take Verapamil? So Verapamil tablets can be taken either with or without food. The tablets should be swallowed whole with a drink of water. They should not be broken, crushed or chewed, as this can damage the modified release action. The dose prescribed and how often the medicine needs to be taken depends on the condition being treated. It is important to follow the instructions given by a doctor. So these will be on the pharmacy label. So you should not drink grapefruit juice while you are taking Verapamil, as it can increase the level of Verapamil in the blood and thus increase the chance of getting side effects. Some key points to remember about Verapamil. This medicine may cause tiredness and dizziness, so you should take care when performing potentially hazardous activities such as driving or operating heavy machinery until you know how this medicine affects you and you are sure you can perform such activities safely. If you drink alcohol while taking this medicine, you should be aware that Verapamil may slow the breakdown of alcohol by the body. So this means it could increase the level of alcohol in your blood and its effects. This medicine should not be used to treat an attack of angina, as it won't work quickly enough. If you go into hospital or to the dentist to have an operation, you should tell the person treating you that you are taking this medicine. This is because your blood pressure may fall too low if you are given certain types of anesthetics while taking this medicine. It should be used with caution in decreased liver function, decreased kidney function, people with a slow heart rate, people with slowed conduction of electrical messages between the chambers of the heart, which is first degree heart block, and also heart failure, conditions in which there are problems with transmission of messages between the nerves and muscles. So verapamil is not to be used in people who have had a heart attack, which is myocardial infarction, complicated by a slowed heart rate, heart failure, or very low blood pressure. So failure of the heart to maintain adequate circulation of blood, cardiogenic shock. And also people with a serious defect in the heart's electrical message pathways, resulting in decreased function of the heart, second or third degree heart block, unless an artificial pacemaker is fitted. Also people with decreased function of the heart caused by failure of the electrical impulse that causes the heart to beat to leave the pacemaker of the heart, or sinoatrial heart block, and a problem with called sick sinus syndrome, which is common in the elderly and is related to poor control of the working of the heart. Although this medicine may be used in people with this condition who have an artificial pacemaker fitted. Also uncontrolled heart failure. So this medicine should not be used if you are allergic to one or any of its ingredients. So you need to tell your doctor or pharmacist if you have previously experienced such an allergy. If you feel you have experienced an allergic reaction, stop using this medicine immediately and tell your pharmacist or doctor. Regarding verapamil and pregnancy and breastfeeding, this medicine should be used with caution during pregnancy and only if the potential benefit outweighs any possible risk to the developing baby. It should be avoided during the first trimester unless considered essential by a doctor. So you need to get further medical advice if this pertains to you. Verapamil passes into breast milk in small amounts. At normal doses, it is unlikely to be harmful to a nursing infant. However, the manufacturer states it should only be used during breastfeeding if considered essential by your doctor. So you get further medical advice from your doctor if this pertains to you. So some of the main side effects of verapamil would be constipation, flushing, headache, nausea and vomiting, dizziness, fatigue, ankle swelling, pins and needles sensation also. And for more information about any other possible risks or side effects associated with this medicine, please read the information provided with the medicine or consult your doctor or pharmacist. How can this medicine affect other medicines? If verapamil is used in combination with other medicines that lower blood pressure, either to treat high blood pressure, which are antihypertensives, or as a side effect, the combination might lower your blood pressure too much. This could make you feel dizzy or faint, particularly when moving from a lying or sitting position to standing. So this is more likely when you first start taking verapamil with one of these medicines. If you do feel dizzy or faint, you should sit or lie down until the symptoms pass and tell your doctor if any dizziness persists, as this medicine, the doses may need adjusting. Other medicines that decrease blood pressure include, so they be ACE inhibitors, so enapamil, aldesleukin, the alpha blockers such as prazosin, alprostadil, the angiotensin II receptor antagonists such as losartan. There may be an increased risk of slowed heart rate, low blood pressure and heart failure if beta blockers, for example atenolol or propanolol, are used in combination with verapamil. Beta blocker eye drops used to treat glaucoma have also been reported to have this effect, so it is recommended that beta blockers are not given by injection to people taking verapamil. There may be an increased risk of slowed heart rate, low blood pressure and heart failure if medicines for irregular heartbeats, antiarrhythmics, for example amiodarone, disopyramide and flecainide, are used in combination with verapamil. So that brings this video to an end. If you have any questions, you can leave a comment below or contact us through our website mytelehealth.info, or call into Lynch's Pharmacy, Douglas, Cork, or ring 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.